Good morning, good afternoon, wherever you're joining us from. My name is Aditya. I'm one of the founders and CTO at Luma Health. And today on Digital Health on Air, I'm joined by Josh Glandorf, the CIO of UC San Diego, also my alma mater. So go Tritons. Josh, welcome to the show.
Thanks, Aditya. Thanks for having me.
Josh and I've gotten the chance to know each other over the last couple of years, just kind of, in the world of overall healthcare, doing some work in COVID back in, 2020, 2021. And I've always found Josh to be a fantastic leader and really just an innovative thinker on the role of the CIO and the role of IT inside the larger healthcare enterprise. So we're excited to have Josh for you to join us today to talk a little bit more kind of just about the role of the CIO, kind of how it's evolved, your path into this. So if memory serves, you moved into the role of the CIO, I think, at UCSD in 2021, if that's right. And so
Right.
I'd love to hear a little bit about your story, like where you came from. I know you've been at San Diego for a while, but you were at Stanford for a while too. Would love to just start maybe for our audience and get started with a little bit of your story.
Yeah, no, happy to share. So I am an industrial engineer by degree, and that took me kind of, into software, which was somewhat unconventional, as most of, my colleagues were going into manufacturing.
Yeah, I was going to say that probably could also equally lead to like oil and gas and like a life in Houston, right?
Oh yeah, 100%. A lot of friends went to Texas and are in oil and gas. But I went to work for a small company named Cerner, which I didn't know anything about at the time, as a college student, and got into healthcare IT. From there, I jumped into consulting with CTG, and then I landed at Children's Hospital Orange County, and I was, more or less an analyst doing build design. And when I came to Children's Hospital Orange County, or CHOC, I was doing more of an integration architect stuff, so just like the more technical back end.
Yeah.
Opportunity at Stanford Children's popped up, Lucille Packard, and went up there. And shortly after, we decided to switch from Cerner to Epic, and so I got the chance to, get my feet wet with Epic and help with that implementation on the analytics front, as well as maintaining the legacy Cerner systems. Was there for 5 years, moved into director of analytics role, and then an opportunity at UC San Diego came about. And when I came down to UCSD, my first role was really driven around bringing UCI, or UC Irvine, live on Epic, on our Epic instance, as the first academic to academic community connect. We did that in about 18 months or so, which was pretty fast. And then my role evolved into, taking on our Community Connect program, so hosting our affiliates, and then taking on enterprise analytics, and then applications, and then an opportunity came up to jump into the CIO role, and
Amazing.
was able to get that. So
There's a little bit there, which you said at least twice, which is the analytics piece. And so I know you did a bunch of that work at Stanford, and it sounds like that kind of rolled up to you eventually, through your growth at San Diego. I'm curious, like, is that something you just like were passionate about, or like just happen to be uniquely skilled at? Like, two times in two big organizations, I'm curious why that had such a specific attraction for you, or people thought you should go do that work.
yeah, that was kind of for me, that was kind of my, linchpin or cornerstone. Like, that's what I really enjoyed. Like, that's what I, super passionate about. That's what I kind of connected with the most, I think, throughout my career. And so that was certainly a part of, what I wanted to be a part of my portfolio ongoing, just because I understand it, I enjoy it. There's a lot of opportunity there, especially in healthcare. And so that was something that, really resonated with me. So, and I think it's, it's something that can be transformative, for an organization.
And when you think about that, like, there's like foundational sets of skills, I think, in the CIO seat, right? There's like a really strong understanding of change management. There's a really strong understanding of like people and process. But then it sounds like there's also like this technical set of skills, which are like really, really critical too. And it's, your background, I didn't really know. I didn't really realize you came up from like maybe like that interfaces and kind of like, that sort of universe. Where do you think those foundational like skill sets are as like people look, as their own career mapping to like get into that CIO seat or like into that VP IT seat?
Yeah, it's interesting because I think every CIO kind of takes a little bit of a different path. Some are more technical and come from the CTO role, and some are more apps focused, and some are more business focused. And at the end of the day, I think you can make the best of, whatever your situation is, and use those skill sets to, to be your strength in the CIO role. Certainly having some technical background and acumen is helpful, right? To navigate, what can be kind of very complicated. But I think also, to your point, change management, there's a lot of other things that are very, very much important to the CIO role. And I think, most importantly is understanding that IT is more than just overhead. It's a strategic lever for the organization. And so trying to position yourself that way.
And I think that's one of the really interesting parts that I've seen in my time here at Luma since we founded the company in 2015, which was like, how's the role evolved? Like, each one of those skill dimensions probably has grown, shrunk, like, the contemporary CIO, which I absolutely think of you as a contemporary modern CIO. Like, what are those skills are kind of the most valuable ones right now?
Yeah. I think it's understanding where the business is going. So, it's less about us, as IT people sitting behind a wall and kind of determining what server,
Yeah, with the mission control of all like the displays up and that sort of stuff.
Yeah. It's, that's certainly important stuff, and cybersecurity and all that is paramount. But I think, number one is understanding and having a seat at the table with the, executive leadership for the organization, whether that be healthcare or whatever. But you have to understand where they want to go, where the organization's going, what the goals are. And then how do you enable that as an IT leader? Because there's, I can't think of a meeting now or a project that kicks off that doesn't have an IT component.
Yeah.
And most of the time it has an IT component that can change the trajectory of that project, right? For the good or the bad, right? Depending on if it's done right or not. And there's certainly innovation opportunities. ECSD, we're doing a lot of innovation, and there's things that we need to understand where we need to go from a business standpoint, so we can understand where we push our vendors, like Luma, where do we need to go to support our business from an IT standpoint. And so that information from operations helps us inform ourselves for co-development with our partners.
One of the things I read a lot about UCSD and Becker's is a lot of the work that you guys are leaning in for AI and kind of like, in-basket fatigue and that sort of stuff. And I really think like that's a particularly good example. I'd love for you to share with the audience a little bit more about that. But, that's the business. Like the care of patients is like actually the charge. That's the mission of the organization. And then taking away from that to do like, a plethora of in-basket messages. Like it's such a clear area where IT can actually influence the business outcome. And I'd love to hear, because I know you guys have been very influential in kind of how those technologies have been developed.
Yeah, no, that's a good point. And I think it's another important skill set is how do you so I know, where the organization is, where they want to go. In our case, as a healthcare institution, physicians are burned out, right? They spend too much time in systems and IT. We also know about AI and its capabilities and what it can do. And so trying to connect the dots there, right? Where are the things take a technology that's new and novel and meld that with a problem that we have. And so that's a big part of our job is making that connection as, IT experts, so to speak.
And so in your say, I'm just kind of curious, like, when you think about, you probably had some physicians, your CMIO types, your service line leaders saying like, could we use these new technologies? And you probably had, yourself saying, I have ideas, or our team has ideas on, how to introduce new things that could potentially help the service line leaders. Where do you like in governance and like conversations, like how do you establish the process to make that, cross function between like, the technology leadership and then like the physician leadership work together for these outcomes?
Yeah, it's a great question. I don't think there's a perfect formula for it, but we do.
I guess what are you guys doing? Because clearly, you've been well recognized for your leadership in that area.
Yeah. Well, a couple of things. We've got a robust CMIO presence, right? So we have physician leaders that practice and are part of the IT leadership team, so they can kind of live in both worlds. We have a Center for Health Innovation, our Jacobs Center for Health Innovation, which brings in new technologies, and the same leadership that runs JCHI is part of our, is me and IT leadership and Chris Longhurst. And so there's a lot of overlap between what are the problems we're facing on a day-to-day basis, what are the new technologies that are, we're bringing in through the Center for Health Innovation, and how do we connect the dots?
Yeah.
So in the case of email, the auto-generated email response for patient messages in Epic in-basket, that was an item that we helped to kind of co-develop with Epic and say, hey, it's an opportunity for us to relieve the pressure on the physicians from a response standpoint, relieve their cognitive burden. Can we do this together? Roll it out. Certainly successful. I think in what we found is it wasn't successful in saving time, successful in relieving cognitive burden, because now I have to read a message that I didn't have to read before, but I can read a message and I can start from, I don't have to start from scratch.
I have a running start on this dialogue, right? As opposed to a zero state boot up.
Yeah.
One of the things that's really been always really curious for me is like, these are like, new and innovative technologies. This is like, this thing is one of many that I'm sure you guys are doing. But one of the challenges a lot of IT projects tends to have, and, is we deploy it and then we forget about it, right? And then it becomes a bit of like digital cruft that sits in the system. And so part of the value, I think, in adopting technology is getting them better over time, better deployed, better implemented, better consumed, just actually making the technology better. So do you guys kind of build a continuous feedback loop through the physician leaders, or like, how do you make sure that like, because even that little nugget you share, which is it didn't save time, but it reduced the cognitive burden, like that's interesting, but like your probably main metric was, can we save time? So like are you evolving those projects after they've gone into the wild?
Yeah, I mean, we certainly try to. I don't think we're perfect at it, but the way we operate is we like to, when we bring on vendors, we like them to be, a strong partner with us, right?
Yeah,
because
sure.
Number one, we want them to listen to our needs, and number two, we want to ensure that we are operating our software at the top of its capacity, right? Because if we don't know what it can do and we're not using that tool for its full function, then we're missing out on opportunities, and that means that we're less efficient, or we're not ideal. So we try to continuously advance each of these solutions. And now it's not, like I said, it's not perfect, and it's something that when you're managing 300, 400, 500 systems in an organization, that's a hard thing to keep track of, but certainly try to do our best.
I remember maybe it was 2 or 3 years ago when you started, I was talking to you and you were like, oh, we're in the middle of deploying a new ERP. I was like, man, if there's anything else bigger than changing out your EHR or EMR, I can't imagine the ERP is any bit smaller. And like you talk about like the interconnected nature of like that sort of stuff, like just managing once it's done, like the amount of work that it just really kicks, like done is actually the beginning of the life cycle of the activity, right? And so I can just, go even further gray thinking about that.
Oh, yeah.
Go ahead. Sorry.
I was going to say, yeah, I mean, it's, we move from kind of one big implementation to the next, but try not to take on too many of the big ones at the same time, because they're super impactful to the organization. But, I think the idea is we'll keep advancing and keep moving forward. As an industrial engineer, continuous improvement is important, right? So just making those incremental improvements continuously adds up.
It's kind of, I'm sure like the Kaizen style of like, manufacturing and process improvement, right? Like you're never done.
Yep. Yeah. And every time, we know we're going to have issues. We're going to have downtimes. We're going to have bugs in the software. We're going to have human error. But every time we have one, we learn from it and we get better for it. So,
yeah, makes total sense. And maybe this is a good opportunity to kind of switch a little bit more into, that where is the CIO role evolved to, right? Because I think you've kind of given us a really good snapshot of like that contemporary modern CIO, like the joint business leader. And I think that one liner you gave, which is really powerful, just like, there's no project now in the health system that doesn't have an IT component. But that probably wasn't true 10, 15 years ago, right? As you were coming up. So where do you think like the biggest things have changed for, not just like, the role of the CIO has changed to become this business partner, but I'd love to kind of hear it from your words, like how you've seen it evolve and kind of with your peer group as well.
Yeah, I mean, I think to kind of sum it up, IT is at the table now, not just to be supportive, just to be transparent that we're doing something, but to be there to guide the conversation into where we should go. So in all aspects, right? So we're building a new building. What new technologies should we be putting in there? We're implementing, a new process or a new system. How are we going to deploy that effectively? How are we going to, create adoption? How are we going to train folks? So we are now essentially the fabric. I think 10 years ago, IT probably should have been at the table, but it was an afterthought, like, oh, hey, I forgot to tell you, but, we've got this new system.
We need servers, right?
Yeah. and now it's people are aware. Okay, what do we need? We've got IT on all the forums. Have you checked with IT yet? And what is the cost? So we've gotten to that point now where everyone understands that there's an IT component. I think the biggest thing, like I highlighted, is having a seat at the table. IT isn't just we're not just overhead anymore. We're helping to change the trajectory and help with the success, aid in the success of the organization. We aid in, not only the success and the outcomes, but also the satisfaction of your employees. We see a lot of physicians that want to go to sites that have Epic. They want to go to sites that have certain systems. They're going to want to go to sites that have artificial intelligence helping them out, right? As co-pilots. Those are going to be things, I think, you look 3 to 5 years down the line, those are going to be big decision points for people when they go to work. It's how successful.
So that actually that goes into a thought that I was, you've kind of described how IT's changed now to being a seat at the table. Is that kind of a vantage point you have in 10 years where IT is actually part of physician recruitment, part of in your neck of the woods, there's 3 major health systems, right? Competing on your IT systems is part of that story.
I think so. Yeah, 100%. I mean, the IT portfolio, I think, is going to be a big part. I would imagine most physicians nowadays are asking some of these questions already. What EMR do you have? What type of support do I have for bringing on new systems?
I love my ambient AI, for my scribing. Can I keep that with me? That sort of stuff.
Yeah, ambient documentation is going to be a big one. That might be a question people are asking already. Do you have this yet? Oh, you don't? Okay, well, this other organization does. I can be way more.
And I know I'm better at my job when I have that.
Oh, absolutely. So I think it's, and it's evolved into kind of a push from the organization, so if you look back 15 years ago, it's, hey, IT, we're doing this stuff. Please help support it. Put in the servers, put in the network, put in the, the cabling, et cetera, to, hey, here's where we're going as an organization. IT, help us create that roadmap. How do we get there? What does the right end state look like? Right. So we just a mission control center, which is kind of the heartbeat of the hospital, and looking at throughput, inputs, outputs, trying to get patients in and out of the facility as efficiently and safely as we can. And that's, that was a huge undertaking.
And that's an IT project effectively, even though it may feel like a facilities infrastructure effort.
Right. 100%. Yeah. And it's turning into something that, people aren't going to be comfortable without. Right. So if we don't have this, if we don't have these check-ins on a daily basis, if we don't have these groups together talking, how can we be as efficient as possible? Right. So, yeah.
Yeah. So let's flip that for a quick second. What do people often get wrong about the CIO role, right? And IT's function? Because we've been talking about all the stuff that goes right and things that we want to do, but legacy is legacy, opinion, carried baggage is carried baggage. What do people get wrong when they come to, your organization and think about your roles?
It's interesting because I think everybody has a different understanding based on their experience with IT. Yeah. Some, I think would say that, IT, historically bad communicators, right? We're doing things behind the scenes and we're just, dumping,
Did you restart the computer kind of stuff, right?
Yeah. New servers, we got pagers and, kind of the old school way of doing things. But yeah, I mean, I think we're trying to up level at UCSD, at least, the user experience as well. And we're all users ourselves. So the, 450-ish IT people. And so we try to, leverage our systems and learn from those and understand, our users' experience as much as we can to make that better. But I think it's, we're trying to be less transactional. I think IT is a very transactional, sending a request.
Here's a service now, get it done for me.
Yeah. Goes into a black hole. I never hear anything back. Trying to be more communicative, right? And so people understand that, how where things sit in prioritization queues, and have a little bit more of a warm, at the elbow type support.
Yeah. One of the that evolution of IT to being that partner, I think is so critical in thinking about how the health, who is IT's customer, right? Because you think about the Epic leadership and people who are the analysts and stuff like that, it's, or even, but your ERP, it's it's facilities, it's maintenance, it's, environmental services. Like, it's the entire ecosystem. It's not just like patients and end users. It's every consumer is effectively touched in some way by the IT decisions, the wins and the fails that come with it, right? So I think like really that systems level thinking where it's like, hey, we're like at the elbow with you becomes a really powerful way to think about IT. Is like, not just as a cost center, but actually it's a part of the core experience that your health system delivers to every consumer in the ecosystem.
Yeah, 100%. And when your network goes down, you find out how important it is, right?
Feels like that might be coming from some lived experience recently.
Maybe.
Well, honestly, Josh, thanks for spending 20, 25 minutes with us today. I mean, I think your experience, in growing into the CIO role and the path that you took coming through analytics, having that technical background and then really kind of growing, the ability to, with your first big project at UCSD of bringing Irvine onto your Epic platform, it really speaks to the volume of how IT can make such an impactful change to such a leading health system. So thank you so much for your time. We really appreciate you spending some time with us on Digital Health on Air today.
Thanks for having me, DJ. I appreciate it.
Cheers.
See ya.